What it do, YouTube watchers? My name is JT, and I have multiple sclerosis. We're going to be talking about neurologists and what you should be asking them. A video we're going to be watching by Aaron Boster. 5 things that you should be asking your neurologist. Now, if you have a neurologist like me, and I'm thinking that you do have MS, if not, that's cool. But if you do have MS, and you have a cool neurologist, you should be able to ask him certain questions and getting a certain answer. But unfortunately, that doesn't happen with my neurologist. Back in Oregon, I used to have a really awesome neurologist, and I could ask her anything I wanted to, and she would give me an answer, which does not happen with this neurologist that I have these days. He is 100 years old and has to ask his nurse how to use a computer every time I go in there. All he wants to talk about is a new medicine he's going to put me on. Well, that's not how it works. So I'm in the I'm currently looking for a new neurologist, but with my insurance, it's pretty much I have to take what they give me. But we're gonna go ahead into this video, and I haven't watched it, but coming from Aaron Boster, he never disappoints. And here we go.
What if one conversation with your neurologist could change the entire course of your multiple sclerosis? If you live with multiple sclerosis, the quality of your relationship with your neurologist can literally shape your disease course. In this video, I'm going to share with you 5 questions that every person with MS should be asking their neurologist. These are questions that will move you from passive patient over to empowered partner. That's where I want you to be.
I'm a passive patient, I guess you could say, with my neurologist not answering my questions. So I'm a passive patient.
By the end of this video, you're going to have a roadmap that you can
Not my
literally
fault.
take into the neurologist's office at your next appointment. Don't turn away, because all of that starts right now. Hey! Howdy! Thanks for learning about MS with me, Aaron Boster. After more than 2 decades of caring for families impacted by MS, there's one thing that I've learned. The very best outcomes occur when a patient and a doc are partners, actual partners in their care. Grab a pen and paper, because in this video, I'm going to share with you 5 absolutely essential questions I need you to ask your clinician. Question number 1, how were you able to confirm my MS diagnosis? Multiple sclerosis is not an emotion, it's not a hunch or a feeling. MS is a biologic diagnosis which is confirmed based on hard evidence. And at any point in time, any one of my MS patients should be able to ask me to prove their diagnosis. And on the spot, I should be able to give them the evidence that led to that so that they fully understand. Your neurologist should be able to explain to you which lesions on the MRI, which findings on your spinal fluid, and which clinical symptoms met the McDonald criteria leading to your MS diagnosis. Moreover, they should also explain to you what steps they took to rule out look-alike conditions. This is important because when you understand how your diagnosis was confirmed, you gain both confidence and clarity, 2 things that every patient deserves. Question number 2, what are our treatment goals? And how are we going to monitor to ensure that my MS drug is working? Every MS disease-modifying therapy should come with a treatment care plan that you and your neurologist hash out. When you ask the question, how do we know if it's working or what are the treatment goals, you're essentially saying, how are we going to gut check and make sure that we're doing the best job to protect my brain and spinal cord? A good answer, in my opinion, would be for the neurologist to explain what they're going to check and why. At my center, we're going to make sure that there's no new spots on your MRI, that you're not having attacks while you're on drug, that your brain is shrinking at a normal rate, not accelerated, and that your exam is staying stable. I'm looking for no evidence of disease activity. All four things. MS is a team sport, and MS Care is a team sport, and you and your neurologist, you share the scoreboard. Question number 3 is which strategies for diet, exercise, and stress management do I need to adopt? Medication for MS is necessary, but it's not sufficient. It's not sufficient by itself to make the disease boring. And if we're going to help you live your best life despite having MS, we need to bring every tool to bear. The science is very clear. Exercising as part of your lifestyle slows down the disease. A healthy diet where you eat whole foods, real foods, and avoid sugar-laden foods and foods with chemicals that you can't pronounce matters as it relates to symptoms and quality of life. Getting adequate sleep and adhering to stress management are key elements to living your best life despite having this condition. A great neurologist will connect you with resources like exercise programs, physical and occupational therapists, and behavioral health specialists as needed to help you live your best life. When you ask this question, it reframes from medicine to wellness for the whole person, and that's what we're really shooting for. Hey, real quick, which of these do you focus on most? Diet, exercise, or stress management? Leave your answer in the comments section below. Question number 4. How will you treat my chronic neurological symptoms to improve my quality of life? This is a really important question because it cuts to the heart of the matter of you living your best life. If we make your MS boring by slowing it down, and at the same time you're miserable because of chronic symptoms, we haven't done our best job. And I want you to ask your neurologist this question. What I'm looking for is help with chronic symptoms that suck, whether that be profound fatigue, depression, anxiety, cog fog, bladder difficulties, constipation, neuropathic pain. My point is, you and your neurologist as a team can game out how to make those better, whether that be by using symptomatic treatments, by going and seeing a physical therapist, by looking at rehab options, or other referrals. By asking this one question, you shift the focus from just treating the disease to improving and living your life, transforming it so that you can live better starting today. Question number 5. If I'm having an attack, how do I get a hold of you and what are we going to do? MS has surprises and not in a good way, and you can suffer an attack. And given that we don't know when that might occur, there has to be a mechanism for you to get a hold of your treatment team. This question allows you to game out ahead of time how you and your neurologist are going to manage that. For example, at the Boster Center, if a patient is having symptoms lasting longer than a day, we ask them to call in. We're going to do a visit with them. We're going to assess them neurologically, examine them, and we're going to make sure they're not having an infection.
All those questions I literally asked my neurologist, and he didn't have an answer for them. Not one. And there's a way for me to get a hold of my neurologist, but it's going through a my chart, and I will type them a message, and I don't hear back from them no less than 4 or 5 days. Choose.
And if we identify that they're having an attack, we're going to arrange for steroids, whether that be at-home infusion, local infusion center, or at our center. I want you and your neurologist to come up with an answer like that. Developing a rapid response is going to help maintain your function and preserve the neurologic reserve. But it's also going to reduce your fear of the unknown, and it's going to give you confidence that if you do have an attack, you and your neurologist know what to do. I challenge you to bring these 5 questions to your next neurology visit, either written down on a piece of paper or saved in your phone. When you do, you're going to stop being a passive passenger and instead transform into the co-pilot in your own MS journey. As always, thank you for learning about MS with me. And until my next Monday morning video or my next live stream, this is Aaron Boster saying be safe and take care.
Well, those are good questions to ask a neurologist. I think I'll put in my phone and ask my neurologist that. Oh, wait, I already did that. Oh, he deflects. Oh. Anyway, guys. Those are 5 questions you need to be able to ask your neurologist and get an answer afterwards. Alright, well, till then, be good, people, or be good at it.